TYMLOS is a prescription medicine approved to treat postmenopausal women and increase bone density in men with osteoporosis who are at high risk for bone fracture or who cannot use another osteoporosis treatment or other osteoporosis treatments did not work well. Do not take TYMLOS if you had an allergic reaction to abaloparatide or any of the other ingredients in TYMLOS. The inactive ingredients in TYMLOS are phenol, sodium acetate trihydrate, acetic acid, and water for injection. Please see additional important safety information throughout and at the end of this video.
I love being a resource for our patients. I love when they feel comfortable to call. Sometimes patients will say, I hate to bother you. And I always say, you're not bothering me. This is my job. I love it when you call. It can be really overwhelming when you get that diagnosis and find out that you have to do an injection. And that's where the TYMLOS Clinical Educator Network can come in to help you with that process and walk you through each step of the journey.
My goal is to help them with that journey and to make them feel comfortable doing their injections, to understand why they need to do these injections.
It allows us to be there to support the patient from the beginning of the process all the way through the injection training.
When the patient signs up for our program, they're assigned a clinical educator, and they'll be with that clinical educator throughout their therapy.
So we get to walk alongside them to help them understand the process, understand the disease state, understand the medication, and be really comfortable and confident doing their injections every day.
When I make the first call, I introduce myself, and I kind of want to connect with the patient and see where they are in the process.
Sometimes patients are really motivated and are ready to get going.
And then for other people, it may just be something that, it's a daily medication. So that in and of itself feels like it's a challenge.
There's a lot of new stuff to take in and process for many patients. They may be newly diagnosed with osteoporosis and have questions about what that is.
How do I do the medication? How often do I administer the medication?
I'm going to go on a trip. What do I do? How do I take my medication? Just different things like that. I forgot my dose. Now what do I do?
Sometimes patients have questions that quite simply we can't answer. So for those questions, we usually refer them back to their healthcare provider. And then the last thing we do is walk through that injection training with them where we go through it step by step.
And as I'm walking them through the steps of the injection, they can see everything that I'm doing, which alleviates a lot of the anxiety and fear. So I think that is very beneficial for a lot of patients to be able to see what I'm talking about.
The sooner you get registered with the TYMLOS Clinical Educator Network, the more we can help.
What I enjoy most is that every day is very different. Every patient is so very different, and what they need from us is so very different.
I try to let my patients know I sympathize, I empathize with them. I totally get what they're going through.
So just being able to really meet them at their weakest moment and walk them through that process absolutely fills my cup every day.
I love to ask patients, why are you doing this? And they say things like, for my children, or so that I can get back to gardening. And on the nights they don't want to give themselves a shot, I ask them to revisit that why. And it's amazing how that keeps you going. It's amazing how encouraging that why can be.
Important safety information and indications. What is the most important information I should know about TYMLOS? TYMLOS may cause serious side effects, including possible bone cancer, osteosarcoma. During animal drug testing, TYMLOS caused some rats to develop a bone cancer called osteosarcoma. It is not known if people who take TYMLOS will have a higher chance of getting osteosarcoma. Tell your healthcare provider right away if you have pain in your bones, pain in any areas of your body that does not go away, or any new or unusual lumps or swelling under your skin that is tender to touch. Do not take TYMLOS if you had an allergic reaction to abaloparatide or any of the other ingredients in TYMLOS. The inactive ingredients in TYMLOS are phenol, sodium acetate trihydrate, acetic acid, and water for injection. Before you take TYMLOS, tell your healthcare provider about all of your medical conditions, including if you have Paget's disease of the bone or other bone disease, have or have had any of the following: cancer in your bones, radiation therapy involving your bones, too much calcium in your blood, or an increase in your parathyroid hormone, hyperparathyroidism. Will have trouble injecting yourself with the TYMLOS pen and do not have someone who can help you. Are pregnant or plan to become pregnant, because TYMLOS is not for pregnant women. Or if you are breastfeeding or plan to breastfeed. It is not known if TYMLOS passes into your breast milk. You should not take TYMLOS and breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of TYMLOS? TYMLOS can cause serious side effects, including decrease in blood pressure when you change positions. Some people may feel dizzy, have a faster heartbeat, or feel lightheaded soon after the TYMLOS injection is given. These symptoms generally go away within a few hours. Take your injection of TYMLOS in a place where you can sit or lie down right away if you get these symptoms. If your symptoms get worse or do not go away, stop taking TYMLOS and call your healthcare provider. Increased blood calcium, hypercalcemia. TYMLOS can cause some people to have a higher blood calcium level than normal. Your healthcare provider may check your blood calcium before you start and during your treatment with TYMLOS. Tell your healthcare provider if you have nausea, vomiting, constipation, low energy, or muscle weakness. These may be signs there is too much calcium in your blood. Increase urine calcium, hypercalciuria. TYMLOS can cause some people to have higher levels of calcium in their urine than normal. Increased calcium may also cause you to develop kidney stones, urolithiasis, in your kidneys, bladder, or urinary tract. Tell your healthcare provider right away if you get any symptoms of kidney stones, which may include pain in your lower back or lower stomach area, pain when you urinate, or blood in your urine. The most common side effects of TYMLOS in women with postmenopausal osteoporosis include dizziness, nausea, headache, fast heartbeat, feeling tired, fatigue, upper stomach pain, and spinning feeling, vertigo. The most common side effects of TYMLOS in men with osteoporosis include redness at injection site, dizziness, joint pain, swelling at injection site, pain at injection site, bruising, abdominal bloating, diarrhea, nausea, abdominal pain, and bone pain. These are not all the possible side effects of TYMLOS. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. How should I use TYMLOS? Read the complete instructions for use provided with your medicine. If you take more TYMLOS than prescribed, you may experience symptoms such as muscle weakness, low energy, headache, nausea, dizziness, especially when getting up after sitting for a while, and a faster heartbeat. Stop taking TYMLOS and call your healthcare provider right away. You should not use TYMLOS for more than 2 years over your lifetime. What is TYMLOS? TYMLOS is a prescription medicine used to treat osteoporosis in postmenopausal women who are at high risk for bone fracture, or who cannot use another osteoporosis treatment, or other osteoporosis treatments did not work well. TYMLOS can decrease the chance of having a fracture of the spine and other bones in postmenopausal women with thinning and weakening bones, osteoporosis, and increase bone density in men with osteoporosis who are at high risk for bone fracture, or who cannot use another osteoporosis treatment, or other osteoporosis treatments did not work well. It is not known if TYMLOS is safe and effective for children and young adults 18 years and younger. TYMLOS should not be used in children and young adults whose bones are still growing. Please read the full prescribing information, including medication guide, at TYMLOS.com.